Don is the CEO of Garrett County Memorial Hospital in Oakland. Don, tell us a little bit about Garrett County Memorial's mission, success factors, number of employees, any other information you'd like Google to know about the hospital.
Garrett County Memorial Hospital is a sole community provider in our county. We are approximately 60 miles or 60 minutes from the nearest regional facility, which means that our local population relies very heavily on our hospital for their primary health care in both emergent and ongoing medical needs. That's of critical importance to the lives and the quality of life in our community, and we take that responsibility very seriously. Our medical staff is comprised of a number of primary care specialists and tertiary care specialists that try to provide the kind of care that folks require in order to maintain their lives here in the county. And we want Google to know just how important our hospital is to our community, and that's why we're participating in this request for assistance. Currently, the hospital's use of technology includes a move towards an electronic medical record within the facility. We have a scanning and archiving program that we operate. We have off-site physician access to patients' clinical records here at the hospital. We also have participated in a number of diagnostic, at-home diagnostic programs to help patients transmit personal care data and personal care vital signs to our home health program. And each of those things have tried to be aimed at maintaining the patient within their home, making their medical record much more portable, and giving our physicians who are in outlying areas in our community access to that centralized record, which is really the goal now of the federal government. We've tried to stay ahead of that curve and tried to innovate in that way so that our patients are better served.
Don, have you heard about the Garrett Google initiative, and if so, what do you think about it?
I've been here at the county long enough to remember when the first ISP came to town, and we can all remember the times when we had to sit for minutes at a time waiting for our computer screens to move from one screen to the next, that sort of thing. The Google initiative is actually very exciting because I think it takes the process of data transfer to the next quantum leap of technology and of speed in a way that certainly would help us in our goals and endeavors to try to improve the portability of patients' electronic medical records, and in terms of the transmission of data that the government is looking to help us all achieve or have us all succeed in achieving, so that they can likewise have some real-time analysis of patients' conditions, diagnoses, some of the queuing issues, some of the access issues. All of that sort of goes hand in hand in improving the patient's experience, which is really what we're all about every day. The Google initiative, I believe, especially helps that process along because the initiative is not limited just to healthcare. It's inclusive of all those components of economic development that includes education, healthcare, government, transportation, and other private industry. It's the coordination of that activity through the Google initiative that I'm particularly excited about. In our own way, Garrett County has always been, I think, ahead of the curve in terms of investment in technology infrastructure. Some years ago, our county government saw the blooming technology industry being of importance to our county and invested in the hiring of a full-time technology director in our economic development department. Subsequent to that, the county invested several $million in a technology incubator program. That incubator program has seen a number of organizations come into the incubator, grow and prosper within the incubator, and go on the outside then on their own to become entrepreneurial organizations and quite beneficial commercially. The Google process to me is an extension of that initial commitment and an indication of our desire to partner with Google to try to make our success even more successful and more broadly accepted within our community. Every community has this desire, but I think we've got the track record to prove that we've already made that investment initially and that we have the cooperation among the players within our county to make that cooperation succeed in ways that sometimes are thwarted because of egos and political limitations in other locations. We think that our county represents the environment and the desire to be successful in technology growth, and certainly that includes both internal and continued internal investment in terms of money at the local level and external participation. You can't beat that combination. As both a county and as a hospital, we consider ourselves to be customer focused. A lot of folks use that term loosely, but here in Garrett County, We recognize the people that we serve are our friends, neighbors, and family, the same people we see throughout the community on an ongoing basis. So it's important that we really understand our market and serve them deeply, because certainly they could seek service or care elsewhere or seek activities elsewhere. It's that service organization that I think aligns ourselves directly with Google. Google, I believe, is also similarly customer focused. And it's the customer focused motivation that has caused Google to decide to go out and create this grant and create this opportunity to create new service. It's not about the money, it's not about growth, it's not about an empire. It really is about serving customers and the users of the system. And it's that strategic alignment that I think we have together with Google that makes us a unique and very highly qualified candidate for this grant. It's not simply about Garrett County's hospital. It's about improving healthcare in small towns and cities throughout the world. It's about helping Google transform the future of medical technology.